Hi, my name is Brooklin Lakin, and today I'm going to be talking about drug abuse, specifically with opioids. Drug abuse of opioids is physical and psychological reliance on opioids, which means you actually have a physical and mental addiction to it, and you will have withdrawals if you stop using the drug. It is found in certain prescription pain medications and illegal drugs like heroin. There are four types of opioids categorized. So there's natural opioids, morphine and prescription pills is an example, methadone, synthetic opioids like fentanyl, and heroin. I placed a picture of Mac Miller on the screen because he was a rapper who recently overdosed on fentanyl, which not a lot of people know is actually an opioid. So, over 130 people die every day from opium related overdose, and combined, this is more than the Vietnam War in 1 year. And this is a problem because it is often overlooked in our society how many people actually suffer from this addiction and how many people actually die from it. So there are more than 191 million opioid prescriptions that were dispensed in 2017, which increases the risk that people will get an addiction to it and will have to find treatment. 2 million people had an opioid use disorder in 2018, and 10.3 million people had misused opioids in 2018. There is a difference because people who misuse opioids, for example, if you have back pain and you have Vicodin at your house and you take a pill, that is misuse, but that does not necessarily mean that you have a use disorder. Heroin is an example of an opioid, and there were 7 times more heroin deaths in 2018 than 1899. The data for this is increasing at alarming rates because it is often overlooked in our society and not a lot of people see how big the problem actually is. So, for example, West Virginia has the highest drug overdose, and this is a really bad problem because not a lot of people can actually get treatment for this. So, West Virginia actually had over 700 deaths in 1 year from opioid overdose. And one example of a famous person who has overdosed from opioids is actually Prince. And one person who was addicted to heroin was Nikki Sixx. And Nikki Sixx, the picture in the yellow, he was actually able to overcome his addiction. So the risk factors for using opioids are if you're young, if you smoke, poor social support, if you yourself have a substance abuse history or a family member does, if you were sexually abused as a child, or if you have severe mood swings. For overdosing on opioids, risk factors are middle age, if you're depressed, if you have anxiety, sleep disorders, unemployment, health complications, or high opioid use, because these factors increase the risk that you will take more pills than you need to not have withdrawals. There are ways to learn to manage your pain without opioids, which is recommended because you don't want to get addicted to the drug. And if you can deal with the pain without opioids, it is recommended. If you are prescribed opioids, though, you want to follow regularly with your doctor, and you want to store and take them as prescribed. You don't want to hold on to them and then take them later. You want to take them when your doctor says it's okay to. In the chance that you do become addicted, there is treatment. So there are clinics that addicted individuals can go to, and they receive group counseling, behavioral therapy, and a combination of these is the best way to make sure that you won't relapse. There is a 12-step program to prevent relapse, which is great because 60% of addicts relapse after leaving treatment, which is not good because you don't want to have to go back to treatment. There is also oral opioids to relieve the withdrawals, which is safe because you will be in the care of a physician at all times when you're taking these opioids to stop having the withdrawals. And to find out more, there are 2 numbers. There's one for the Hills Treatment Center in Los Angeles and also the CDC info on opioid combat, and both of them can give more information. And these are my references. Thank you so much for listening to my presentation.